Hi, I'm Mike Chartrand. This is just an update to my story about grade 4 varicocele. And in video 1, you can look at part 2 of grade 4 varicocele for a table of contents. This is just how it's going for me on March 21st, 2017. In video 1, I put up a letter that I had written to Dr. Ross McMahon about seeing him about my varicocele. My complaint is that the scrotum is 3 times the regular size, and I want that taken care of. He basically just, I coughed in his hand when he did the Valsalva test. He had my scrotum in his hand, so he made me cough during the Valsalva test. He refers to the Mayo Clinic, and he also refers to an ultrasound that was done in 2012 here in Canada, in Winnipeg. And my complaint again is that because of the size, and when it's warm especially, it's big, so I had a hot water bottle on. My complaint isn't about reflux, it's about the size of it during the day. And as far as I can tell, all that they know here in Manitoba is that if there's reflux, we do surgery and we cut in the groin. They don't know anything about collateral veins. They don't care about collateral veins. They don't care about the size of it. All they care about is if there's reflux, we do surgery, and that's it. I complained. I said I have to complain to the health authority if you don't send me for venogram or microsurgery. Here's what he writes back. I received your email dated October 24th requesting phenography or microsurgery. I reviewed your chart concerning your clinic visit on March 25th, 2015. I also reviewed the information from the Mayo Clinic you provided. Neither my examination nor the scrotal sonogram performed on March 22nd, 2012 showed evidence of a varicocele. The ultrasound from the Mayo Clinic showed several borderline dilated veins, approximately 2 millimeters in diameter in the scrotum. These are not considered to be significant. He doesn't quote the part saying it's uncertain, and he doesn't quote the part saying it's definitely a right varicocele. Fuck. There is no indication of testicular venography in this case, as there is no evidence of a significant varicocele. No evidence of a significant varicocele. I showed him a picture of the bunched skin and the thing hanging down. I had pictures with me of the scrotum 3 times the size. What does he want to be significant? I'm not walking. No, I was also I have a new family doctor. She referred me to the spinal surgeon. The neurological surgeon says there's not enough evidence of significant back problems, and I'm attributing them to the varicocele. So twice a day, I put on a neoprene bodysuit that's hanging on my wheelchair over there. I drive my $12,000 scooter. I walk 2 meters to the scooter. I get in the scooter. I go to the YMCA, and I do my physiotherapy routine twice a day. I'm not getting significantly better. I can, it might not be significant to you, but the physiotherapist says, oh, I says it's hard to pull my belly button in to the spine. And she says, well, you're not using your transverse abdominals. And that is all connected to the rectus abdominal sheet or whatever, to the internal oblique, which is connected to the cremaster. I can't pull up, and I feel pulled down. I don't know if that makes any sense to you, but it's important. So just going back, just reviewing, I complained to the health authority. They set me up. They said Dr. McMahon will see you, and then they call back and he says he doesn't have time for a long time. They give me an appointment with Dr. Sultal. It's just killing me to put these documents on USB and to go across the street to Staples to get these documents printed. But here's what I'm submitting for Dr. Sultal. This is the letter I put up in video 1. From a sport and spine expert that I've been seeing for a long time. He's the guy I was seeing and went to about the shower story, and that's why I was referred in the first place for surgery, is because of that shower story in the last video. He has had long-standing hip and low back trouble. There does appear to be some exacerbation of his difficulties in this area, in the hip and low back, because of the varicocele. Because of the varicocele, and I underlined that. Then I'm including the surgery report that I showed in video 1. Then I'm including the Mayo Clinic report and my letter to Dr. McMahon and my letter to the health authority, and which says, my complaint is that Dr. McMahon has not referred me for venography or microsurgery. He bases his letter that I do not have a significant varicocele in 2 ultrasound reports. I expect that no urology professor would make the claim that an ultrasound is a conclusive test on blood flow. My left scrotal bag of worms expands and contracts daily, about the same size as the right, to about triple the size of the right. Yet the right side was given a definite diagnosis of clinical varicocele by the Mayo Clinic in the same report, last paragraph, that Dr. McMahon uses to call the left varicocele not significant. This report clearly states that the blood flow on the left side is unclear, and possibly a persistent left varicocele is just not detectable by Doppler ultrasound. The later report that Dr. McMahon refers to says that no convincing varicocele was found. Clearly, both reports are inconclusive. Clearly, my right varicocele is untreated, and blood flow is slow in the left at best, which warrants venography before bilateral surgery. After my 2008 surgery, Dr. Milner said it was all he could do to cut off my testicle. This is not true and very offensive. If Dr. Miller was willing to cut it off, certainly venography is warranted first, unless there are missed veins to hide, unless he's trying to hide something. That's where I am now. Thanks for watching, and I hope this is helpful to some of you out there too. I'm proposing a study on varicocele so that your urologist will have an easier time defining a varicocele type syndrome of some kind of common disabilities or a pattern of injury and disability that people with high-grade varicoceles have, especially those whose surgeries hadn't worked, in the failure group to resolve pain. Okay, thanks for watching.